I recently recorded two different videos about coming home from treatment, and it occurred to me that it might be helpful to do a series starting from the beginning and going through the whole process. And so I want to begin with if you have a loved one or someone you know who may need help, someone in the midst or the grips of an addiction, and what to do with that, and how to best approach that, and some common issues that arise. And this could apply to most of the issues that we consider to be addiction: substance use disorder, gambling, sex addiction, um, alcoholism, right? Anything that would require the need for, let's say, a treatment intervention, inpatient treatment, which I'll talk about later. But so someone is struggling, and one thing to know about this issue is that what can be so obvious from the outside, looking at the individual, may not be as obvious to the individual struggling with the issue. So I say that because often loved ones, family, people around the person can just assume or think, how can't this person know, or surely they know how bad and awful and much help they need, and that's not necessarily the case, and oftentimes it's not the case. Addiction, the illness, and I know that there's this issue with the language we use, but um, addiction, these illnesses don't care about language, and so I'm not trying to be offensive to anyone. It's just what I'm most comfortable using. I don't feel like saying substance use disorder every time. It's just so I'm not trying to be offensive. But these illnesses, you know, cunning, baffling, powerful, right? So the individual that has this illness, this addiction, they they don't see certain parts that may be glaring to the outside because that's what the illness demands, right? You think about it, an addiction, a dependency on a a substance, a behavior, an action, uh, cannot coexist with honesty, transparency, and acceptance, right? These two things live on separate planes. So when you try to apply ration, reason to these illnesses, that's never going to match up because by definitions, these illnesses are completely irrational. They're unreasonable. And so by looking at it from that framework of, my goodness, this person's killing themselves, surely they know that and they'll want to help. Well, not so fast, because they have an illness that speaks to them in their own voice, saying, everything's fine. You're fine. Like, you're not hurting anyone. Like, what's the big deal? What's everyone getting so upset about? Like, leave me alone. You deserve this. Like, and also the illness is saying, like, the worst thing that can happen is that we get sick, that we go through withdrawal, that we don't get what we want. Like, death is nothing, right? So if pain and death were proper um, consequences for the addiction, then you would see people get clean after overdose, and you don't. You absolutely don't. Overdose and being Narcan, what you often see is people just returning to use, way more often than not. So death is not a deterrent. So you have to, first of all, from that framework, realize that that you're dealing with an illness that is different than maybe perhaps you've encountered before. The other thing that is really can be very helpful to keep in mind, but is not easy, is that there is a difference between the individual and the illness. And so it's the difference between I have an illness, I am not the illness. So, there is an illness in me that requires deception. It requires dishonesty. It requires me to tell you exactly what I know you want to hear. It requires me to play sleight of hand and distraction, right? That's what the illness requires. Because again, the illness and honesty cannot coexist. So, but that's not who I am. It's something I have. So, and I say that because it's so important, or not, for your own protection, because it's exhausting and it's really painful to deal with someone who is in the grips of this. Things are said, things are done that are just so incredibly painful, and you can start to think, wow, this person's really evil. And these words that are being used now that are in the common lexicon, which are so overstated, like narcissism, um, they'll be used, but they're not. It's so inaccurate and so unhelpful, because that's just addiction. That's what it requires. Of course, I only think of me. Of course, I'm self-centered and selfish, because that's what this illness requires. I want what I want when I want it. And so there's a couple of things that have also come into the common framework that I think are unhelpful. One is that the person has to be ready. And I think that's a deadly saying. First of all, what does that even mean? You have to be ready. Ready, you're looking for a diseased brain to make a good decision. And I don't know what ready means. And I don't know what is the proof of ready. And sometimes it takes some intervention, or some um, someone to step in and say, hey, this is what's going on, or this is what we can do, or we have these ideas, or maybe go to this place and bring someone to the help they need, and offer and be there, rather than waiting for someone to be ready while they're in the midst of what are often fatal illnesses. So it would be akin to someone being diagnosed with cancer and say, well, we'll offer chemo, but only when they're ready. Like, what are you doing? Like, no, let's get the chemo on board. Let's get the help. Why are we waiting for this person to be ready? And the other thing that gets said a lot is they have to do it for themselves. And I disagree with that as well, because it doesn't matter why you do it, as long as you do it, right? So if I go to treatment because I want to stay out of jail, or save my marriage, or continue to see my kids, or keep my job, or just get out of trouble, I still go to treatment, right? That's the outcome that's desired at that stage of the game. And so this idea of doing it for yourself, well, when you're in the midst of the illness, what you're doing for yourself is often self-destructive. And so you want to get away from do for yourself. And the hope is that at some point along the process, it will become internalized, but to expect that at the onset may be too much. And so it doesn't matter why you do it. And being ready is very subjective, and you can stop at any point along the process and get the help. You don't have to hit this bottom. Your bottom can be anywhere, and if we wait for people to hit bottom, the bottom too often with this illness is death. And then, it's too late. And so if you know someone that needs help, um, I think the first step is to offer help, right? Seems simple, but let's go Occam's razor for a second and go with the most simple answer is probably the right one. So someone needs help, offer help. And first of all, you never know, right? Because in the midst of addiction, the grips of the worst of it, there are these moments of clarity and these little moments of what am I doing? I hate this. I don't want to do this anymore. Um, and so you might just hit one of these times of, hey, it seems like you're not living the life you'd like to live, and some things are getting in the way. There are places to help with this. Do you want to give that a shot? And you just might get somewhere. Um, you want to have something ready to go when you ask that question. You want to have a place to go, something lined up, because that window of opportunity is pretty small, right? So when someone's ready, um, to say, yes, I'll go somewhere, or willing rather, um, that window may slam shut after hours or certainly days, right? So they may make a new decision pretty quick because these illnesses are very, very strong. And they will talk someone into the idea, well, it's not that bad, or what's the big deal, or wow, I really shouldn't have said that, or I said too much and I'm going to go disappear, I'm going to go underground again. So we want to strike while the iron's hot. Um, if they say, no, I'm good, I don't need any help, then the idea is to be there in a loving, supportive way, um, but not in an enabling way. And enabling is another thing that gets a really bad rap. So enabling, people feel bad for enabling, people feel guilty, but enabling is really just another term for that is just loving someone, right? You're enabling because you think it'll help. You're enabling because you love someone and hope that what you're doing will be helpful. So it's not helpful. It's not, but it comes out of a place of pure love. So um, enabling essentially is making it easier for someone to use rather than more difficult for someone. And you never want to make it easier. So part of helping someone get the help they need is cutting off some of these avenues of them using whatever it is they're using. So if they're unwilling at the moment to just enter into treatment or get some help or look at the issue, then you can um, be there, loving, supportive. I'll be here whenever you're ready to get help. I'm here for you. I'm going to help you through this. However, if you're going to continue to engage in this behavior, I really can't be a part of that. Therefore, and then whatever the on your part the willingness to cut off is, financial support. We can't. Hang out on Fridays and we're at the bar because I can't be a part of that. Whatever it is for you. There's some really helpful resources out there to help with this. Um, I am highly, highly biased in this because I love these folks and they're tremendous. But um, uh, Jeff and Deborah J are just fantastic in this realm, in this world, and I will say that you have to be careful in this world because there are some there's some bad players. When you get into treatment, when you get into this world where um, some people see an opportunity, and there's some bad actors. So, but when it comes to intervention, when it comes to helping people, Jeff J, Deborah J are just tremendous. And so Jeff, they have a book, first of all, called Love First, which is a tremendous book on how to approach someone and how to put together an intervention, either with a professional or with yourself, but it's a tremendous outline. Deborah J wrote a couple books that are tremendous, just tremendous when you're dealing with this kind of thing. One is called No More Letting Go, and the other is called At Wit's End. And I would highly recommend both of those to give you kind of some more insight into how to deal with this, because this is heavy stuff. It's really difficult to deal with someone in the midst of addiction because, like, I'll tell you, you know what powerlessness is when you're dealing with someone caught in the grips of this stuff. So um, get the help you need. Realize that even though this may be the identified patient, you're you're going to need some help too. You don't get through this unscathed, and so get the support you need, get the help you need. And then in the next video, we'll talk about if someone does accept help or if they flat out refuse help, kind of what to do next. So I'll see you then.